of a health department such as ours in New York City. We all benefit, even outside the city limits, from having a health department with these kinds of resources. So I'm glad you all came this afternoon, because this evening we have two of those great resources right here, okay? First of all, Commissioner Hemans-Henry, who is Assistant Commissioner, and I'm reading this because I want to get it right. I want to get every word right. She is Assistant Commissioner for the Bureau of Public Health Training and Information Dissemination. Think about this. Health departments do environmental. They do disease control. They do behavioral health. They do many core public health functions. Many of them have sophisticated laboratories, okay? But in New York City, we have the added branch of information dissemination as well as training. And we know that in public health, one of the most fundamental niches that we own is this mission of training the future generations of people who will carry on in our field. And now let's not get too carried away by what I'll say next. But Commissioner Hemans-Henry Division, Bureau, okay, is going to be training people who are going to help folks who have not even been born yet and who may not even be born in our own lifetime. Think about that for just a minute. And not just people who will do this in the confines of the huge city of New York, but they will have left New York City. They'll be doing this literally all over the country, all over the world, because of the type of training that her bureau provides. And we also have, and again, I apologize for reading, Janice Blake, we just met a little while ago. She is Senior Director of that bureau's Office of Workforce Development. Again, say no more. In many ways, and this is why I'm a dean in a school that teaches public health, the most important thing we can do with our own skill set is to pass it on to the next generations, which means you, but it also means the people you will teach and train. So we have so much to learn from these two fantastic assets that come to us from New York City. Thank you so much for coming. Please give us our best wishes to the Commissioner and tell her she is always welcome. And we hope you always remember with pleasure your time here at New York Medical College. Thank you very much.
Thank you. All right, good afternoon, everybody. Oh, come on. Good afternoon, everybody. All right. Thank you, Dean. I like to hear people talk about training in public health like that. I don't think I need to say anything else. Sometimes it's hard to convince people that training is an important thing to continue to do, you know, for staff once they're at a health department. And so I'm going to talk a little bit about what my bureau does and then turn it over to Janice to talk more directly about the internship program that we have. All right, so let's see. So I'm going to just give you a very brief overview of the health department and then an overview of the Bureau of Public Health Training and Information Dissemination. And then Janice will talk about HRTP and EPI Scholars, two of our internship programs, and then we'll leave some time for Q&A. I know that we're competing with, in terms of time, for your poster, your showcase this afternoon, so I'll speak quickly. All right, so our health department, as our dean said, we are one of the largest public health agencies in the world. I like to think of it as the best health department in the world. One of the things that I like to do best is to convince people to come to work at our health department, whether as interns or as staff. And for those who leave, I encourage them to come back. I'm one of those people who was at the health department before I left, and I've been back. This December will be 17 years. I mean, I don't look it, right? and I have no intentions to leave. Janice is also one of those who is back on her second run. That I think speaks volumes. So we have a $1.6 billion budget. We use that money to do a lot of things. Some of the examples Janice will talk about of projects that students work on will illustrate some of the work that we do. But there's a lot of work to be done in New York City. So a lot more money, is probably needed. We have staff of about 6,000, and they're located across the 5 boroughs. Our main office is now in Long Island City. We moved there in 2011. And we have staff in a clinic setting. Some are in our neighborhood health action centers in the 5 boroughs. So the mission of the New York City Department of Health is to protect and promote the health of all New Yorkers. And our main role in the Bureau of Public Health Training is to prepare staff to do that and to ensure that those who come, whether they were trained in public health or not trained in public health, but to prepare them to continue to be able to promote the health of all New Yorkers as new diseases are found, new ways of treating them are found, new ways of teaching people how to practice good health. We need to provide them with the training for that. So not on the slides here. All right, so this slide here just shows where the Office of Workforce Development, where Janice sits within the Bureau of Public Health Training. So I'm going to take us back one step above our second box here, the Office of Workforce Development. And I don't have slides for that. So the Bureau of Public Health Training and Information Dissemination, which I oversee, has 3 offices: the Office of Workforce Development, our Office of Information Dissemination, and our Public Health Preventive Medicine Residency Program. So I don't know if there are any medical students here. They? All right. Well then, spread the word. So our main role is to ensure that the current and future public health workforce is trained. So for the current public health workforce, we're looking at our staff, providing them with trainings, epidemiology trainings, statistics, data analysis trainings, grant writing, program evaluation, any of those key things that people might need to do their jobs. In that same office, in the Office of Workforce Development, where we provide training to staff, we also ensure that staff have opportunities to develop professionally. So we offer things such as Epi-Grand Rounds, public health lecture series, a poster presentation so that staff get an opportunity to practice, to present posters, and to share their information across the agency. In our Office of Information Dissemination, we have a public health library. So staff have access to online journals. We do have some antiques, old journals, bound journals, but most of our work now is done online. For materials that we don't have, we're able to get those for staff. The intent there is to make sure that staff have access to the latest types of public health information so that they don't have to go off site to get it or to wait for long periods of time to get that. And then our public health preventive medicine residency program, there we train physicians in public health. So we accept 7 residents and they spend 2 years with us, 2 years working on an MPH program. Most of them do that MPH degree at CUNY. They also can do it at Columbia or at downstate. And then we have an elective program where physicians outside of our residency program can come and spend a month or so to learn about public health. So the theme there in terms of our internship program and our residency program is experiential learning, where staff get where the interns and residents get a chance to work, do hands-on work with preceptors across the agency for extended periods of time. Some might spend 6 weeks, some might stay years to learn about public health and the way and our initiatives and that sort of stuff. So I didn't talk about HRTP because Janice is going to tell you all about HRTP and Episcolas. So I'll turn it over to her now to talk to you about that.
Can you hear me now?
Yes.
Okay. Hi, how is everybody doing? No, we're gonna try that again. Calaine did that, we're gonna try that again. Hello, how is everybody doing?
Wonderful.
Okay, that's a little bit better. Coffee not kicked in, okay. I drove all this way, you gotta give me some energy, folks. All right, thank you. Again, my name is Janice Blake. I am the Senior Director of the Office of Workforce Development within the Bureau of Public Health Training and Information Dissemination. Like Calaine said, this is my second go round at the Health Department. This year makes my 9th year. I was gone for a couple of years. I was there for 4 years, and I left and came back, and now this will make my 9th year back in public health. At my 9th year back at the Bureau of Public Health Training and Information Dissemination. I've been in public health a really, really long time. So just really, really quick, just so I understand who's here today. First year students, second year students. Okay, and just really, really quickly, what are your concentrations?
Health policy and management.
Okay. Epi, environmental. That's it? Did I get everybody? Health policy management, you too? Okay, great, great, great. There's a place for everyone at the health department. Okay, this is the team. We call ourselves the team. Some people call it the dream team. We say we're small, but we're mighty. And we try to make sure that everyone has a good experience when they're with us with HRTP. Again, Calaine is our assistant commissioner. I'm Janice Blake. Jem Badina, she's our new director of HRTP. I was director of HRTP for 8 years, and Jem was my intern when she started. So now Jem has moved up to director, and I moved up to senior director. So we are true to the game, right? Talking about true to the game. And Daisy Lee Sproul, she is our administrative coordinator. Just this couple of seconds, I just want you to take a look at this, just seep this in. Right? We can't be ready if we're not ready. Does that make sense?
Absolutely.
Right? We can't be ready until we're ready. And the way we get ready is by training our future public health workforce, right? We can't just walk in the office and expect it to know what it is that we're supposed to do. That's a fallacy, right? Erroneous and cause for trouble. Yes, agree with me, disagree. You have to talk back to me. My mom's was a mental health counselor. I talked to myself. She said, that's dangerous. She said, don't do it, Janice. Don't do it. So if you don't talk to me, I'll talk to myself, and then I'll tell her that you made me talk to myself. So let's try it again. We can't expect ourselves just to walk into an office and know what to do. We have to have some sort of training. Someone has to give us some sort of guidance, right?
Absolutely.
Okay. I'm going to tell you a story. Some years ago, before I got married, a long time ago. This year's my 19th year, so it's a long time ago. Before I got married, my husband and I, we went on a trip. We went on a place to call the Hideout. Okay, Coconut Mountains, Pennsylvania, right? Sounds a little suspect, right? You're familiar with it. So we went there, and we were driving. It was before, cell phones the way we have them right now. And the GPS said, "You are there." I looked out this way. I saw nothing. We looked out that way, we saw nothing. We looked that way, we saw nothing. We looked that way, what did we see? Nothing. I said, we're not here. He said, we're not here. I said, well, do you want to get out and check? He said, no. Okay, he's as much of a city ass as I am, right? We don't do the urban world. We don't do anything but urban, right? So we're sitting there in the car trying to figure out what we're going to do, right? Remember, GPS says you aren't here. Imagine getting someplace and having no idea where you are. This is 10 o'clock at night. I'm in another state. I have no idea where I am, and my GPS says you are here. How do you feel? Quickly. Okay.
Lost.
Okay. Lost. Right? And uncomfortable. Right? We don't want our public health work. Does that make sense? So at HRTP, we offer you the opportunity to get free training before you go out into the work. Again, Calaine talked about all of this, talking about it being the oldest and largest health department. And I think it's a success story. We pat ourselves in the back. We call it a success story. The goals of our program to orient our students with principles and practices of public health, to broaden the student's concept of what public health is. I love it when a student comes in and says, Janice, I didn't know you all did that much. Okay, I remember one year when I just got to HRTP, a student came in and she was one major, and I put her on a project. She was matched to a project. And she was like, I don't understand why I was selected for this project. And she went on and on and on. At the end of the summer, she said, I think I'm changing my major. I think I found love. Okay, so again, open the concepts of what public health really is. Because sometimes we come in with a fixed definition.
Oh, I mean you.
Sometimes
Try to meet the other
it
people.
comes.
Let's see if we can unmute you. Yeah.
Sometimes we come in.
Yes? No?
Do we need one?
Shoot.
Want you to unmute all of them.
Yeah.
All right. Give it a shot.
Okay, is that better?
Unmute all.
Try it again.
Is that better at all? Yeah, I think it's
Yeah.
not giving me any feedback at all.
Okay.
Mute them and just talk about it.
Muted from us. We'll try not to do that.
It may not even need anything to do with muting, it may just be bad batteries at
That
that
it may
point.
be the microphone.
Yeah, that's it. I muted everybody.
Or close to listen, close to your ear.
Sure.
The one she's holding in her hand, I don't know what one it is. Okay, sorry. Okay. All right. Okay, one's coming.
Okay, should we continue or should we?
It's back, it's back.
It's back? Can you hear it now?
Yeah.
Can you clear that from the screen?
Oh, yeah.
So my biggest joy is when a student discovers public health. Even when I meet a student and we're talking about something, and then I say, well, do you know that that's public health? Okay, let's take your 5 fingers. Everyone's got 5, 4, a couple of them. Okay, great. Barbara, one else is saying? Okay, great. So if you look in the middle of your palm, right, I want to think of that as health. But then you look at, there are things that are connected to it, right? There's housing, there's education, there's economic factors, there's your environmental factors, and your social factors, right? Okay, so public health is all around us. So when I get a student to see that and say, oh my gosh, wow, that really, really excites me, okay? So broadening the student's concept of public health. We also assist the agency recruiting staff. An internship with the health department does not equate into a job at the health department. I'm going to say that one more time. An internship at the health department does not mean you get a job at the health department, but we do have a pretty good record of interns becoming staff.
Working, huh? Yeah, I know exactly what happened.
Thank you. So who interns for HRTP? I'm here today to invite you to become an intern at HRTP. I'm here to invite you to apply to become an EPI Scholar. I'm here to invite you to consider becoming a public health volunteer. And I'm going to tell you a little bit about those. HRTP, undergraduate, graduate, and professional students. We have undergraduate students, freshmen. We do not accept by year. We take once you are in school and an undergraduate and matriculating, you're welcome to apply, you're eligible to apply. All the way up, we do have medical and veterinary students and law students who apply as well, seeking public health opportunities. We have typical majors. Public health is our number 1 major. Most of our students are public health majors, epidemiology and medicine. However, we accept students of all majors. We believe that that public health is interdisciplinary, right? And we need majors from all fields to make our work the way it is. We ask our interns while they're there to think about how you experience real-life challenges at public health. And that's what HRTP offers, an opportunity to experience the real-life challenges of public health. That can mean from a change in your project. That can mean by putting that aside because there's an outbreak investigation. I talked to a student yesterday. She said, Janice, I said, what's the matter? She said, I'm going to get lunch. And I said, what happened? She said, I haven't had lunch in a week. And I said, well, what's been going on? She said, mumps. Okay. She's working on the outbreak for mumps. So she's working on coordinating response to a mumps outbreak. So it's been hot and heavy at work for her. Work on the current relevant public health issues. Again, we're talking about mumps. That's current and relevant right now. We're talking about working under the close supervision of experienced staff. Some are leaders in their field. Some are written journal articles that you read in your class. And just imagine that you're reading, you're walking, and it happened, where you look up and you see Dr. Bassett. Like, I just read an article by Dr. Bassett, and she's right there getting a bagel from Mama Bites. Okay? I just read an article by Dr. Barbeau, and she's right there. She just said good morning to me. You know, you see an article by Catherine McVeigh or by Michael Sanderson. These are folks who are working in the health department that you are hobnobbing on a daily basis. We're asking you to think about HRTP, where you apply your classroom learning to practical problems and to learn critical skills in your field. We ask our HRTP interns to come visit us, and we want to expose you. We want to expose you to the different facets of public health. I like when folks said, emergency management, what's that? Ah, come my friend, come. We have room to convert, right? Like Calaine said, convert folks to public health. We have a summer seminar series. In the summer, we invite our students once a week to come and learn about what the health department is doing. We have folks coming down and talking about what exactly is going on in their area so you can learn the different parts of the agency. We also have workshops. We have GIS workshop. We have an R workshop, a SAS workshop, questionnaire design, survey design. None of these things are important to you guys, right? Okay. We do have lectures and we do have site visits. Calaine mentioned our Neighborhood Action Center. We take a visit to our Neighborhood Action Center in the Bronx, and we take another one to our Action Center in Central Harlem. Meet preeminent scholars and professionals and learn about their current research and network with peers in the field. I won't tell you this, right? Calaine, you're not listening, right? But Calaine and I met when we started working in public health. That's how long we've been working together. On and off, but still working together. Role of preceptors and mentors. We ask the staff who serve as our preceptors, my colleagues, to serve as preceptors, to also serve as mentors. We serve a dual role. Okay, it's totally different to be a preceptor and a mentor. They can be separate, or we ask them to be one person. Okay. In that role, we ask our preceptors and mentors to train the students in hands-on public health work. So you are there, you are getting this work done. Again, I love talking to the students. It's Janice, they sent me an email. I said, well, what happened? What they told me to do something. I said, well, what happened? I had to do it. Yeah, you did. You know, or I went to a meeting, and what happened? They told me they asked me a question. And what happened? They told me I had to give a response. Yeah, that's usually what happens at a meeting. You know, you come on in, but you're part of the fabric of the work. You have an email address. You are expected to go to the meeting. You're expected to take notes. You're expected to participate in the discussion. We ask our preceptors and mentors to set goals for the students' educational and professional development. We ask that we encourage the students to network. That means coming to the seminars, and we also have just events just for our interns so that they can network. And we encourage our interns to form their own network, go outside of the office and have some fun time. We also ask the mentors to provide feedback on the students' work. And why do we do that? Because we keep all that information, and sometimes someone calls me back and says, Janice, I see that so-and-so was an HRTP intern and so on and so forth. Can you tell me a little bit about that experience? I go back in a little record, a little database, and I can say, oh yeah, she had a good experience, he had a good experience, this is what they worked on. Is this a viable candidate for this project I'm working on? Yes, I think this is a good candidate because of X, Y, Z. And I know that one student who we had last summer, she was hired immediately. She was hired so that she had to finish her internship a little early so she could start her consultant job right after the program. And she's not full-time, but she was with the agency for 6 months working on the project. And it was because of that call who said, Janice, can you tell me if this is a good fit for my program, for my project? How do I become an HRTP intern, Janice? So we are currently accepting applications for summer 2019. This is really important for you. How many folks live in Westchester County? Okay. How many folks live someplace else? Okay. I asked that because HRTP has 3 sessions, summer, winter, summer, spring, and fall. For the summer session, we do not have a residency requirement. For the summer session, we do not have a residency requirement. For the spring and fall, you must be a New York City resident. So if you're living in Westchester County with a Westchester County address, you're only eligible for our summer session. Everybody okay with that?
Yep.
All right, okay. So how do I become this intern, okay? You apply. Our website is, applications are now open for summer 2019. Applications opened on January 15th and they close February 15th. So you still have time if you have not begun the process. Completed applications are reviewed. There are scores that we recommend. Candidates are matched with projects. When you're applying to HRTP, you're not applying to a project, you're applying to the program. Once you've been accepted to the program, HRTP team and our team that we reach out to in the agency, those who are HRTP friends, they will then, once you are accepted, we will then make recommendations as to matches for projects. So each project will have 3 to 5 students sent out for interviews. Okay? The preceptor reviews and makes a selection. You go through human resources and you start your internship. Again, because if you're living in Westchester County, you are eligible for the summer and we're currently taking applications. If you're New York City residents, you're welcome to apply for all 3 sessions. In our fall and spring, we call that our part-time sessions, a minimum of 10 hours per week and a maximum of 20 hours per week. We want to make sure that the HRTP experience complements, not competes with your academic program. Okay? In the summertime, you can go a minimum of 20 hours and a maximum of 35 hours. And most of our interns, we're working to be, until I told you this, we're working to pay all our interns. Okay? We do ask for a final paper, product, or presentation. We find that that's a valuable public health skill to be able to write a paper summarizing the work that you've done, or perhaps make a PowerPoint presentation of the work you've done, or perhaps provide a product. Usually that's a SAS code book or some flyer that you've gone out or a module that you've created for public health education. And then of course we ask you to evaluate. We ask that you, the intern, evaluate the program and the preceptor, and we ask the preceptor to evaluate you, the intern. It's a competitive program. It's a competitive program. In the summer, we get around 450 to 500 applicants per year. And that's been a pretty consistent number, that history that I can remember going as far back as I can. Again, just some planning. Anyone who likes to forward plan like I do, just some ideas of what our dates are and thinking about when to apply. And we're always months ahead. So right now we're thinking summer, and then shortly thereafter we'll start thinking fall. Applications for fall are open July 15th. Sure.
Quick question, what are the actual dates of the internships in the summer?
We don't have a date for internships. Our internships start after Memorial Day-ish, after the 15th of May, and they finish toward the end of August, depending on the school schedule. Some folks leave as early as the first week in August, some are all the way up until September when school restarts. We do have a formal orientation in the summer, but as in a start date and a stop date, that's up to the program and the preceptor and the student to determine. Okay. What exactly do I need? You need a completed electronic application, a personal statement, and a part of that is to upload your resume or your CV as part of the application. That's all done online. By email, you'll send to us, or your school will send to us an official transcript, and we'll need a letter of recommendation, and we also have a reference form, and those come in via email. These are just some pictures from HRTP interns over the year. This is our seminar series. We're in the conference room at Long Island City. This is when we went out and we're giving awards at the end. When you do your presentation, we give you an award. It's signed up by the commissioner. This was one year we went to Gracie Mansion. We had a barbecue at Gracie Mansion for New York City interns. And yeah, this is just more pictures and more pictures and more pictures of interns. I want to talk to you a little bit about EpiScholars program. EpiScholars is our graduate epidemiology program. Surveillance and biostats majors are welcome to apply. We're excited about this offering for New York Medical College because we've expanded the schools that we partner with. And in doing that expansion, we've invited New York Medical College to become part of our EpiScholars partnership. So we'd really like to see more students apply from New York Medical College to be part of the EpiScholar program. EpiScholars is only summer. It's a summer-only program, and it is a paid program. Again, only for top graduate public health students in epidemiology from select schools. We only work with 21 schools of public health that are eligible to apply for this program. Graduate interns are provided an opportunity to practice applied epidemiology skills. And I'm talking about real work. I mean, we had a student who did an analysis last summer. She did an analysis of the types of mosquitoes in New York City, where they come from. Didn't know that there were so many species of mosquitoes. Where they come from, what they carry with them, and how they're imported into the United States. Some are local and some are actually coming in on the plane. So it's really interesting to learn that. And then that way we can target what messaging we're doing and what areas that we need to target with certain messages because of the type of mosquito that comes from that region. Also, EpiScholars cultivate future leaders in epidemiology. Again, a lot of our EpiScholars are at the agency, spent some time working at the agency. Some have gone on to medical school. One emailed me the other day. She's looking for a letter of reference. She's working at CHOP, Children's Hospital of Philadelphia. Somebody else is working at UNC. Somebody else is a professor at UNC. So again, we like to keep our network tight with the EpiScholars program. We'd love to hear what our students are doing. Somebody just released, I don't know if you heard about it, but they had a release mid last year about the health of New York. And it was a whole series of papers. And one of those writers was our EpiScholar. And we have another one who just released, and they're scheduled to release her article this week as well. So we're excited to hear all of this. A lot of the work EpiScholars do over the summer continue on and result in a publishable manuscript. Our goals, again, is for EpiScholars program to fulfill unmet training needs of public health schools. Oftentimes, EpiScholar opportunities and HRTP opportunities fulfill your practica and your field work requirement and your capstone requirement. And we encourage students to come back and serve at the local level, right? Come back and serve at the local level. HRTP is our older program. This year is our 59th year. I haven't been there that long. But HRTP is 59 years old this year. EpiScholars is newer. It started in 2007. And again, we expanded to LA and to Seattle. So we did expand nationally. We don't have our partners anymore. So the program will only run in New York City this summer. We're hoping to convince them to come back on board. These are our participating universities. Again, now open to 21 schools. Again, you get money. I think the calculation was it's $11,000 plus for the summer as an EPI scholar. You're mentored by some of the nation's leading epidemiologists and researchers. Again, you're fulfilling your practicum opportunities in one summer. Think about that, one summer. When I did my MPH degree, I had 420 hours to do. The man that is now my husband spent many a weekend dropping me from one site to the other site because I was working full-time, one site to the other site for me to make that 420 hours. Just consider doing that in one shot over the summer. If that's an opportunity for you, just really consider thinking about that. Also, EPI scholars, you really get to work on your SAS, your SPSS, your Sudan, and your R skills. I mean, you really get an opportunity to work on that. Must come in with a foundation. Whatever level you are, you will leave 5 levels higher. Again, opportunities of the program. At the end of the session, just like for HRTP, EPI scholars present. You interact with and collaborate with EPI scholars, that are those, again, other students in that network, and you work on a publishable report and a manuscript. Just like HRTP, the application period is the same, January 15th through February 15th. If you're applying to both programs, not all students are eligible for both programs. At this institution, you are eligible for both programs. And if you're applying for both programs, you can let us know and we'll try to reduce the paper burden on you. Some of the forms can be shared. Again, an electronic application, a transcript, we can share your transcript, letter of recommendation, a reference form, and a personal statement. We ask you 3 questions, you give us 3 answers. Again, HRTP, just like in HRTP, you are applying to the program. Once you pass round 1 and you're going on to match, that's when you get to select what kind of projects you're interested in. You'll go for an interview and your preceptor will make the final determination. Again, a little competitive, but that's okay. You guys are great, right? Okay, only one person said yes. You guys are great.
Yes.
Okay, that's so much better. Again, some pictures of EPI scholars over the years. They went to the Mets game this year. It was soaking wet, but they had a good time. And then this other year, they all hung out at this one person's house. She had an apartment for the summer that she borrowed from someone, and then that was like the EPI Scholar house, and they all went over there and had great fun time. And this group was just really, really sweet. They're just sugary sweet. It's wonderful. It's nice and small cohort, and you leave with a network of friends, and you need to leave with a network of colleagues. Again, what do our mentors have to say? Year after year, mentors say, this is great. I would not have been able to do this project without this dedicated assistance. Mentors acknowledge that, again, without someone doing this with dedication, day after day, we would not have advanced this work, and they appreciate your time there at the agency. Again, our program spreads because of word of mouth. That's our #1 way we get our students. That's what students tell us. And we ask that students go on and take on leadership roles where they go, and we're here to support you once you take that role on. Any questions from me? You guys gotta give me some energy. Okay. I've got questions for you. Okay, someone told me that they're in epidemiology. What kind of research are you using, and what kind of statistical programming do you use here? You use SAS, okay. And what have you done in SAS so far?
So far, just the introduction, just had one.
Okay. And what are your interests? I know some folks give me your concentrations, but what are your interests? What's your public health issue of interest?
Yes,
The HIV, the prevalence of drug use among LGBT community.
I've got a project for that, okay?
So,
Okay. Anybody else? Every year, there's an annual review of PrEP and PEP uptake within certain communities. 1 year, it was the African American community. 1 year, it was an older lesbian, gay, bisexual community. So it's interesting to hear what they're doing this year, but they do a survey with pharmacists, and the information they come back is just phenomenal. So it's an annual review project. So again, just thinking about it. Anybody else?
Traumatic brain injury.
Okay, we don't do traumatic brain injury too much. We do have injury epi, though they do have some stats on that. I don't know what their numbers are, but the preceptor there, she says, I like it morbid. She always says, I like it morbid. So we do have some data on that. Okay, anybody else? What are your interests?
Emergency management.
Emergency management, we've got a huge OPER, it's our Office of Emergency Response, Preparedness and Response, always looking for innovative ways. Now they've expanded like, I don't know, crazy. And now they're working with emergency management and healthcare and getting healthcare facilities ready for emergencies. Anybody else?
Patient safety. Patient safety.
We don't do too much on patient safety. We do a lot on access. And that's a really big thing right now, access and turning data into action. All the data collected from emergency health records, how can we transform a practice to use that data to get that into improving health outcomes? Okay, anybody else? Yeah. Maternal health, we're doing a lot of work on that. A lot of work is about doing, you guys are aware, right? There's a disparity between Black women and other women, yeah, as to babies and who's living and who's dying. Not only the babies, but also just maternal health. So they're doing a lot of work on that. There's a breastfeeding initiative, and there's a maternal infant child initiative, exactly. Just to find out what's going on and how can we change that disparity and just improve that inequity.
Yeah, I'm the vice principal separately. I was in the school, in the city school. I was the one of the benefit for the health department, those internships. So I'm just wonder, do you still have those internships for the biostatistics major?
Absolutely, we welcome biostatistics majors. Absolutely welcome.
Yeah, because I see your list of the major. I say, okay,
all majors, but we take. No, absolutely, don't. No, please. We love biostatisticians, and they're absolutely welcome to apply.
Okay, thank you. I do remember I one of the benefit person. Yeah, I still remember that if I could say or something, in your health department, again. Thank you.
Okay, thank you. All right, any questions for me? I have a little thing.
Question.
Okay, sure.
In terms of employment, I just want to know, like, work in the Department of Health, how the national student graduation is applied?
Okay, that's a loaded question. Okay, I'm going to answer it two ways. I don't work in HR, but from what I understand from HR, this is what my understanding from HR. The agency will not sponsor you, but if you have permissions to work, then you can apply to the internship program and you can apply to work in the agency. Okay, does that help? Okay.
Isn't it the criteria to select students like we are in our first semesters and we are in prior experience in it? So if you want to apply for the scholars, you will select us or something to
For EPI scholars, it does require you to come in with some foundational knowledge because part of the application is stating your fluency and your proficiency in the applicable data software. So yes, we do like students to come in with experience, and I would encourage you to think about where experience may be found in your day-to-day world. I would encourage you to think about, you have, and correct me if I'm wrong, because I've been nosy since I've been here this afternoon, but you've got PT, you've got dentistry, you've got medicine, you've got public health. Research.
Speech language pathology.
Right?
Speech.
Right?
Yes,
And
very
speech.
good.
But those are all places where you do research, right? All places where you use SAS, you are, SPSS, yes? Okay, so you've got to get out there and you've got to go to that professor, you've got to go with that courage, and you've got to go to that professor and say, can I help you with that? Okay, and that's how you get the skills to move on to the next level. Okay, does that help? Okay, also consider your local public health department, consider your local CBO that's working on that issue that you're passionate about. Go there and knock on their door and tell them you're offering free help. You might close it a couple of times, Okay, they might close the door a couple of times, but keep going back to offer your assistance, and I'm sure you can get there. Okay, because you want to learn, but you also have to provide something in exchange. Does that make sense? Okay. Anything else? All right. For more information, this is where you can find us on the website, on the internet. Any questions you may have, you can email us at hrtp@health.nyc.gov. It's our general inbox. You can reference this conversation or just general information. We also ask that you share this with someone. Again, word of mouth is our biggest advertisement. So we do ask that you share this with someone and let them know about the opportunities that HRTP affords. And again, if not HRTP, if not EFRI Scholars, if not the health department, get an internship. I think that this is really what it's about. Get an internship because that's getting your foot in the door and getting some experience doing the work.
Can you volunteer?
Absolutely, volunteer counts. Absolutely, volunteer counts. And you can volunteer here at the health department as well. You can volunteer, yeah. And I have for you some flyers about HRTP if anyone wants to take them. I also have flyers for EFRI Scholars and for our Public Health Volunteer Corps. Our Public Health Volunteer Corps is for recent graduates. Okay, 23 months out of school, you're eligible for a Public Health Volunteer Corps where you can come back, get a public health experience right after graduation. Okay.
I have a question. Can people who are graduating in May apply to HRTP?
I am sorry, but they're not. If you must be matriculating, meaning returning back to school. So graduates are not able to apply for EFRI Scholars or for HRTP. Recent graduates, just graduating December, graduating in May, you are eligible to apply for our Public Health Volunteer Corps, which opens in October. Thank you. Okay, I've got gifts and I don't have anyone to give them to. Except for my friend back there, so he gets a gift. I can't carry this back with me, so. I usually make you guys work a lot harder for this, but we invite you to come on in. This is just some of the intern swag that we got. Right, some of the intern swag that we have. And take some time, read this. Awesome, awesome, awesome. Okay. Thank you so much. And on the other side of the room over there, she was talking to me a lot. Where's my friend? And I think she said she was an epidemiology major. Were you epidemiology? Who's anyone here presenting downstairs today? Any posters we should take a look at?
What?
I was just wondering if anyone here was presenting downstairs. Okay, so what poster number should we find?
This is great.
So my name is Jeremy, and I did apply for the EFRI Scholar last
Oh,
week.
nice.
Yeah, but I only got through to the interview.
Okay,
Yeah, so I guess I kind of found out when I'm graduating.
okay.
So I was just wondering, so you said volunteer open to